Hi everyone, I hope you're having a wonderful week. I'm Katharina Kang, Missions Program Manager for Komen, North Texas. I'm excited to be back with you again for our monthly educational series sponsored by NTT Data Inc. If you missed last month's episode about knowing your family history of breast cancer, be sure to check it out. All of our videos are posted here on our Facebook page in the video section and on our YouTube channel. Just search for Komen, North Texas. Today we're talking about an issue that may occur in some breast cancer patients after surgery and radiation therapy, lymphedema. Let's break down the word lymphedema. First, what is lymph? Lymph is a milky fluid that contains white blood cells. White blood cells are very important to our immune systems. They help fight infections. Lymph vessels, just like blood vessels, run throughout the body, but they carry lymph, cells, and other materials from tissues and organs in our bodies to the lymph nodes where it is filtered. Lymph nodes are found throughout the body, but the ones near the breast are the ones that can be affected during breast cancer surgeries and treatments. The second part of the word edema means swelling resulting from a buildup of fluid in specified locations. So put the two together, and lymphedema is swelling caused by a buildup of lymph fluid. So how does lymphedema occur? During breast cancer surgeries, some of the lymph nodes in the underarm, these are called axillary lymph nodes, may be removed to check to see if they contain cancerous cells. This removal, while very important, can cause problems. Sometimes lymph vessels become blocked, preventing lymph fluid from leaving the area. When that lymph fluid from the blocked lymph vessels collects in the arm or other areas, it causes swelling. Swelling can be so slight that it's barely noticeable, or it may be so great that you see a visible expansion. In severe cases, lymphedema can cause pain and limit movement. Lymphedema usually develops within 3 years of breast surgery. Sometimes it occurs many years after treatment ends. Although not common, if lymphedema occurs right after surgery, it can be reversed. Now, the good news is that today, because modern surgery removes fewer axillary lymph nodes than in the past, most people don't get lymphedema. And typically, the cases that do occur now are less severe in terms of impact on movement and the way the arm looks. While we know that lymphedema is related to axillary lymph node surgery and radiation, it's still not clear why some people get lymphedema and others do not. However, we have discovered certain risk factors, which are having a large number of axillary lymph nodes removed, radiation to the axillary lymph node area, having lymph node removal plus radiation, having a large number of axillary lymph nodes that are cancerous, infections in the area post-surgery, and being overweight or obese. The risk of lymphedema does not seem to be impacted by whether or not a woman has breast reconstruction after a mastectomy or the type of breast reconstruction a woman chooses. Like we said earlier, lymphedema is not as common today as in the past, but it's still important to know the signs and symptoms of lymphedema and talk to your healthcare provider immediately if you notice any of these. They include swelling in the arm or hand, feeling of tightness, heaviness, or fullness in the arm or hand, feeling of tightness in the skin or a thickening of the skin, and pain or redness in the arm or hand. If you notice any of these symptoms, the most common way doctors diagnose lymphedema is to measure your upper and lower arm widths. In fact, measurements may be even taken before surgery to have a comparison for after surgery. Although there is no cure for lymphedema, treatment can improve movement and reduce pain and swelling in the affected arm. Standard treatment includes complex decongestive therapy, which aims to decrease swelling and infection through a combination of skin and nail care, compression bandages or sleeves. These apply pressure around the arm and help push lymph fluid out of the area. Exercises, manual lymphatic drainage, this is a type of therapeutic massage, and physical therapy. While you can't prevent lymphedema, you can do a few things to reduce your risk, including maintaining a healthy weight, being aware that lymphedema is a possible side effect of treatment, seeking care when you first notice signs or symptoms, and taking steps to reduce the risk of injury and infection. On Komen.org, we have listed several resources to help those who have lymphedema. which include the Komen Treatment Assistance Program, which provides financial assistance for lymphedema care and supplies, as well as other treatment expenses, National Cancer Institute Lymphedema, where you can find more information about lymphedema, and the National Lymphedema Network, where you can find a support group, physical therapists, financial assistance for compression garments, and information about lymphedema. That's all we have for today's topic. Thank you all for tuning in, and thanks to NTT Data Inc. for sponsoring our Facebook Live educational series. I want to give everyone a quick reminder that registration is open for the Wichita Falls Race for the Cure, which will be on Saturday, October 6th at the MPEC in downtown Wichita Falls. You can also visit our website to learn more about the second installment of our Komen Scholar Series. On Friday, October the 12th, we'll hear from Komen Scholar Dr. Brian Schneider about his Komen Research Grant and the work he's doing on identifying genetic markers that will predict which patients will experience side effects because of chemotherapy. Visit KomenNorthTexas.org to learn more. Thanks again for tuning in, and we'll see you next month.